Okay, I think we're live.
Yes.
Good afternoon, ladies and gentlemen, and welcome to another SADA public webinar. I'm going to share my screen quickly. Okay. My name is Dr. Tinesha Parbhoo, and I will be explaining the role of the various members of the oral health team today in order to hopefully make it easier for you in the future to understand which practitioner to choose when faced with a particular problem. So today, as an overview, we are going to be discussing the role of the dentist, the dental assistant, the oral hygienist, the dental therapist, as well as the various dental specialists. Oftentimes, when one is suffering from toothache or bleeding gums or any other dental condition, it can become confusing knowing which member of the oral health team would be the most appropriate to consult with. Each member of the oral health team has a particular and specific role that they play, while these roles and functions may sometimes overlap between the various disciplines. So today, I will provide a brief explanation of each discipline with examples of the types of conditions that they treat. Each of the disciplines mentioned must be registered with the Health Professions Council of South Africa in order to legally practice in the country. And usually the various disciplines will work in conjunction with each other in order to provide optimal patient care. So let us start off with the dentist. The role of the dentist is to act as a primary oral health care provider. So they will be involved in the diagnosis, the treatment, and prevention of oral diseases. Generally, the dentist will perform basic dental procedures like fillings, extractions, as well as cleaning of the teeth, which is a scale and polish. But they can also provide certain specialized care, such as crown and bridge work, dentures, implants, and orthodontic treatment. Their role is also to educate patients on oral hygiene and preventative care. A dentist can practice as a sole proprietor, or they can be in partnership with other oral health professionals. And a dentist is also allowed to prescribe medication as long as it is relevant to the dental condition. Moving on now to the dental assistant. So the role of the dental assistant is obviously to assist the dentist, dental therapist, or the dental specialist during procedures to suction, to hand them instruments, and to mix materials for the dentist. They also prepare the treatment rooms and the equipment prior to the patient arriving. They make sure that all the instruments are sterilized, and they can also be involved in educating patients on post-procedure care. Moving on to oral hygienists, their main role is to focus on preventative oral care. So they generally will perform teeth cleanings as well as root planing. They also educate patients on proper oral hygiene techniques, and they will generally assess your oral health and then provide you with preventative treatments like fluoride application on your teeth or fissure sealants if necessary. And they can, if they want, confine themselves to a specific discipline, like an orthodontic practice in which they may be employed. An oral hygienist in South Africa can work under supervised practice, meaning that they can work under a dentist or a specialist, or they can work as an independent practitioner in their own practice. Next, we'll be discussing the dental therapist. So the role of the dental therapist now is to provide basic routine dental care to the patient. So they also perform fillings, extractions, and preventative procedures, as well as oral health education and other promotion of preventative measures. They do teeth cleaning as well, and they also prescribe medication which are fit for certain dental conditions. For example, a tooth infection, they can prescribe antibiotics. However, they are not trained to perform specialized procedures. Examples of these would be dentures, crown and bridge work, surgical extractions, etc. For that, they would either refer to a dentist or they would refer to a dental specialist. Now we're going to be discussing the various dental specialists. So basically, a dental specialist is a dentist who has then further gone and specialized in a particular field. There are various specialties in dentistry. However, today we will just be focusing on the 4 main categories: orthodontists, prosthodontists, periodontists, and maxillofacial and oral surgeons. So firstly, what is the role of the orthodontist? So they specialize in the diagnosis and the treatment of malaligned teeth and jaws. They also design and implement orthodontic treatment plans like braces and clear aligners. They will then monitor the progress of the treatment, and they will make adjustments as and when necessary. They are also allowed to employ an oral hygienist in their practices, and they can also be involved in the treatment of multidisciplinary cases alongside other dental specialists or other dentists. For example, they can work alongside a maxillofacial surgeon in an orthognathic surgery case. Moving on to the prosthodontist, their role is to specialize in the restoration and replacement of missing teeth and oral structures by substitutes that are not readily removable. So they design and they fit dental prostheses like dentures, bridges, crowns, and they usually work in more specialized and complex cases. They also restore implants and they restore the general function and aesthetics of the oral cavity, but they may also restore facial structures that have been affected by disease, injury, surgery, or congenital defects. So for example, they can make an ocular prosthesis, a nasal prosthesis, and ear prosthesis, amongst others. The next specialty is the periodontist. So the periodontist specializes in the prevention, the diagnosis, and the treatment of the supporting tissues of the teeth. So basically, the supporting tissues would be the gums, the periodontal ligaments, as well as the bone. They will do scaling and polishing, root planing, they can do gum grafts, and many other periodontal surgeries as well. They also assist in monitoring and maintaining the periodontal health of the patient. They also restore function by placing implants to replace missing teeth, and they can treat soft tissue diseases and also perform biopsies of the skin, the soft tissue, as well as bone biopsies. And then lastly, we move on to the maxillofacial and oral surgeon. So their role is to perform surgical procedures in the oral and maxillofacial regions. They can extract impacted teeth. They can perform dental implants and jaw surgeries. They also treat facial trauma, like fractures of the facial bones when there is a car accident, assault, etc. They also treat oral pathology. For example, if there is a tumor of the jaw, whether it's benign or metastatic. They perform bone augmentations in areas where bone is deficient, such as the lower jaw. And they also treat congenital defects like cleft lip, cleft palate, etc. So in conclusion, the dentist will refer to the patient to the specialist for complex cases. There must be a collaboration between the dentist and the specialist to ensure comprehensive care for the patient. The patient then benefits from the expertise that is tailored to their specific needs, and optimal outcomes and patient satisfaction will only be achieved through teamwork between the dentist and the dental specialist. Okay, that brings me to the end of my presentation today. I hope everyone learned something. I see we don't have any questions for today, so have a lovely afternoon further. Thank you.